I think students should choose the Aurora University School of Nursing because of how passionate the nursing faculty are. We're all very dedicated in developing the future professional nurses. We not only want you to be successful in the program, but getting your licensure and then being excited and passionate about being nurses yourselves.
Our professors really want us to succeed. They'll stay after hours and help you with any questions you have. They're always an email away. I think it's nice to have that backbone that you know that there are people there to help you and that want you to succeed and be good nurses.
The professors all bring their own knowledge base, so it's really helpful to take their stories and their input and their tips and tricks and all that good information that they give you, and it really makes you well-rounded once you get out in the field.
And I think the nursing program at Aurora University is very diverse in their faculty as well as their students, and it exposes people to things and opinions and perspectives that they'll also be exposed to during their clinical settings as well as when they become healthcare professionals.
The community between the AU nursing students is great. Whether you're in the class, in simulation, in clinical, you always have a group of students with you, someone to study with, always someone to practice with. Everyone in your cohort is there to help you because they want to get through it as well. No one should have to go through nursing school alone, and I don't think anyone does at AU.
I think simulation is one of the most important things we do in nursing lab because it's where you get to really take your first attempt at being a real nurse. So you make decisions that if you were in the real field it would be high risk, but when you're in sim lab it's a good way for you to take those chances, see how you do, and then debrief with the class and your instructors.
Even if you're an observer, you can observe other classmates and then you can think about what you would have done, what you would have done differently, what they did really well. Collectively, it helps the whole group.
Lab are small, so you have actually 2 faculty to about 16 students so that we're constantly able to help you with those hands-on experiences.
They'll help you out and make sure you're really refined in your skills.
Everyone's nervous their first day, but I definitely felt prepared to go into a patient's room for the first time.
When I am going to clinical, I get to meet with patients, see their problems. Being on the med-surg floor with all the patients, seeing everybody come post and pre-op, getting to do all those things. Skills-wise that we learned in lab, I got to really incorporate that in that clinical.
We have a really great relationship with a lot of the employers in the area, and that is where our students do their clinical rotations. So many of them even get hired because their employers are seeing how well they perform. Your bachelor's degree in nursing prepares you for entry-level nursing practice in a variety of different settings. You could be a home health nurse, you could be a nurse that works in a hospital, in a doctor's office. You could even get jobs in prisons, in long-term care facilities. There are so many different opportunities, including businesses that hire nurses to come and help screen their employees and keep them healthy. There's just an endless number of opportunities when you get your bachelor's degree in nursing.